Good.
Good. You guys ready? All right, thanks. All right, well, thank you for coming today. Quite a bit to go over. So, unfortunately, today is our deadliest day of COVID thus far, and also it is our biggest day of new COVID cases thus far. If I could, I'll go over those briefly with you. The first death is a 17-year-old young lady who was a resident of Lancaster. She expired in the emergency room before she could be admitted. The next is a man in his 30s who was a resident of the city of Dallas. He died in an area hospital. The next is a man in his 30s who was a resident of the city of Garland. He also was in a hospital. The man in his next is a man in his 40s from Carrollton who died in a hospital. Another man in his 40s from the city of Lancaster who'd been critically ill in a hospital. A man in his 60s who was an inmate at a state correctional facility and had been hospitalized. A man in his 70s who was a resident of the city of Dallas and was critically ill in the area hospital. A woman in her 70s who was a resident of a long-term care facility in Dallas. A man in his 80s who was a resident of a long-term care facility in the city of Dallas. And a man in his 90s who was a resident of a long-term care facility also in the city of Dallas. Of the cases requiring hospitalization, who reported employment, 77% have been in critical infrastructure workers, with a broad range affecting occupational sectors. And this would include healthcare, public health, agriculture, and food. And by the way, agriculture and food mostly means grocery stores. Public works and essential functions. Of the cases requiring hospitalization, most have been over 60 years of age and had at least one underlying health condition. I keep reminding folks of this, but let's see, what is it today? It is about a third, back up to about a third, of the folks requiring hospitalization have diabetes, okay? So if you're over 60, particularly if you're over 65, or if you have that condition, you're much higher risk of being hospitalized with this. Of the 94 deaths reported today, 40% have been associated with long-term care facilities. Now, most of the over 3,000 who are sick are not in long-term care facilities, but the mortality rate is much, much higher there. All right, so with the governor's decree yesterday opening up more businesses throughout Texas and here in Dallas and here in North Texas, and without any grace in there for areas like ours that are seeing increasing cases, it's up to all of you, both business owners and individuals, to make really good personal responsibility choices, okay? The governor's orders have changed yesterday, but the underlying science has not. The recommendations from the CDC and your public health authority and your infectious disease leaders at your hospitals, your epidemiology leaders at your local hospitals, that has not changed. And so, for instance, in places with substantial community spread, like we have here in North Texas, you should not go to congregate settings, right? So whether that be a backyard barbecue, whether that be any other congregate setting, that's to be avoided. As the governor said yesterday, particularly if you're over 65, you really want to avoid leaving your home for any sort of an unnecessary trip. Of course, the challenge with that logic, as that veers away from the recommendation of our local medical community and the CDC, is we don't live in a vacuum, right? So if we don't choose to go to a crowded movie house, but our neighbor does, that has an impact on all of us. And so really, I want you to think about, as you're thinking about how to act in this new age of kind of things are going to be open, ask yourself, okay, President Donald Trump has said, and the CDC has said, that you don't want to loosen these restrictions, these safer at home restrictions that have been so successful, until you have 2 weeks of decline. And what does decline look like? Well, that would be decline in deaths, and decline in number of cases, and decline in the amount of hospital admissions. So let me give you some stats, so you understand what we're dealing with. I count weeks, or I say the health community counts weeks, beginning on a Sunday and ending on a Saturday, okay? So on the 3 weeks ago, that would be the April the 12th through April the 18th. That was thus far our deadliest week. We had 33 of our residents lose their life to COVID. And we had 97 average daily cases of COVID. Last week we saw a dip in both those numbers, and we were hopeful from that. And so that would be from 419 until 425, you only had 21 people die. And you had 84 people on average a day test positive for COVID. Today is our third day of this week. And so I want to, give you this big disclaimer, the week's not over. God willing, we'll have a great week from, going forward with less deaths and less cases. But so far this week, Sunday, Monday, and Tuesday, our average per day of cases is 110. So the highest average thus far that we've seen so far. And the total number of deaths is 13, on pace to be right at or slightly above or slightly below our deadliest week. So that's where we are. So clearly that is not 2 weeks of decline, right? Even if we wipe out this week and we take last week would be our first week of arguable decline. Although, as Phil will talk about when he comes up, we're not actually seeing a decline in hospitalizations, okay? And the hospitalizations are inching up a little bit. But we have not seen 2 weeks of decline. That's number one that the Trump administration and the CDC says you need before you loosen up the restrictions. And I'm not telling you this to second guess the governor. I'm telling you this because now it's up to you to make good decisions. It's up to you to decide what you want to do as a business owner and a resident. So thing one we didn't meet. Hadn't been 2 weeks of decline. It's our deadliest day and our most active day of new cases. Okay? Thing two is, around that, you got to have those 2 weeks, and you got to have sufficient testing around it to make sure that as you open up these restrictions and those folks go back to work, you can provide those workers the safety and those patrons the safety they need with rigorous testing around those folks. Texas, unfortunately, is 49th in testing. We were dead last yesterday. We got a little bump, or Michigan actually maybe got a little lower. But anyway, we're 49th today. We're well below where we need to be, according to our local health doctors, to get to where we need to be, okay? They say, we can make a quantum leap towards getting there if our federal partners and our state partners could get the reagents and the kits that we need at UT Southwestern and Parkland that we've been asking for a little over 3 weeks now. But unfortunately, those haven't happened yet. Those are scarce. They haven't come through with those yet. And so where we are is depending on whose numbers you look at, we either have 1/4 as many tests as we need or 1/3 as many tests as we need, according to the epidemiologist and the infectious disease doctors at the local hospitals, okay? So you look at those two criteria, you say, well, what does that mean? Okay, there's 2 criteria to loosen the economy for me to feel comfortable going out and doing this thing that I want to do because I've been cooped up in my house. And the first is 2-week decline, which we haven't met. And the second is testing, which we haven't met. And what they tell us is that when you try to do these things as you're going up, as you haven't met the peak yet, but you're going up, really bad things happen. And there's some models out there. You can play with those on the internet if you have the time to do it. I think Rafael Anchia, State Representative Rafael Anchia, who I think is at Rafael Anchia on the internet, pointed out one that you can actually plug Dallas numbers in and see what happens with certain assumptions. So you can do that, but here's the thing. The point of all that is this. Regardless of what you think or what I think, on May the 1st, we're going to see more and more businesses open, and we're going to see more and more movement out there, and we're going to see more and more opportunity for asymptomatic COVID to bump into you and get you sick. And so the question that you got to ask yourself is, what's the best decision for me and my family, right? And so just because the law allows you to do something, open your business, doesn't necessarily mean you're going to. And you've seen some responsible business owners, similar to what you saw last week with houses of worship, where the CDC says in places of substantial community spread, you shouldn't have in-person worship. And so you saw the you saw all the imams at the beginning of Ramadan, then you saw the Catholic diocese, most of the mainline religions all say, hey, you know what? We're going to follow the CDC guidance, not the allowance from the governor that we can all have a large worship service. Similarly, you're now seeing movie theaters saying, well, I understand what you're saying, but we're going to follow that guidance that it's not safe to do this yet. So most of those aren't opening either. But some will, right? Some businesses are going to open. And some of those businesses, it may be perfectly okay for them to open. But you're going to have to now be in the position of making that decision for yourself and for your family. And remember, it's not just for you as maybe you're feeling young and invincible and stir crazy being in your house. It goes back to what we talked about early, Operation Protect Nana, Grandpa, and Meemaw, okay? Because there are people out there who fall in this category, like we've talked about, where they're over 65. They have an underlying condition like diabetes. And if we, spread this and they get it, really bad things will happen there. Also remember that if we follow the science, if we all make good choices, and it's not what we're allowed to do, it's what public health and what the CDC tells us we should do. If as many of us as possible will follow that, that's the surest way to get our economy moving again, right? If we don't have a huge spike in cases, that's the best way for us to be able to get to that next group of businesses and the next group of businesses. Or in Governor Abbott's orders, to be able to get to where it's a 50% opening and a 75% opening. But that can only happen if we make good choices in the face of these orders that are not aligned with where our local public health community is, right? For our part, what we'll do there, and I'll let Phil talk in a moment about things that are going on in our long-term care facilities. I want to say a couple of things about that before I turn it over to him. But, for our part, what we'll do is we're going to work with businesses. We had calls, after the governor's came out with his orders yesterday. Our public health community took a look at those. Our business community looked at those. We're going to work with our business community to try to the extent that these things are going to happen, to have them happen just as safely as we can for the employees, for the businesses, and then for you. We're seeing increasing outbreaks in areas. Now we're having outbreaks in a sausage factory and some food service places. I guess Phil probably answers some questions about that. We're seeing a total of 177 inmates now that have been confirmed positive with COVID, increasing outbreaks in nursing homes. One of our calls tonight that Phil and I will have, Dr. Wong and I will have tonight, along with the head of FEMA and others, is how we get more nursing homes tested faster, okay? And so that's really going to be important as every day we're announcing more, seems like every day anyway, we announce more deaths at these nursing homes. I'm going to let Phil tell you more about that, and I'll come back and answer some questions. Thank you.
So as the judge mentioned, today 135 new cases reported. I mean, that is the largest number we've had in a single day, and our case count is now up to 3,240 cases, including the 94 deaths and the 10 new deaths today, which was as high as we've had in any single day also. As the judge mentioned, so in the jail, we have now 177 inmates been confirmed positive. Also, total of 15 jail employees been positive. In the homeless shelter, still 42 associated with Dallas Life. In the long-term care facilities, Monticello West, 33 residents or staff members, 15 deaths. Skyline, 58 residents or staff members, 3 deaths. Edgemere, 11 residents or staff members and 4 deaths. Reserve at Richardson, 15 residents and 3 deaths. Brentwood Place 1, 77 residents or staff and 6 deaths. St. Joseph Village, 1 resident, 0 deaths. Villages of Dallas, 1 resident, 0 deaths. Brentwood Place 2, 19 residents or staff and 1 death. Winters Park Nursing and Rehab, 2 residents or staff and 1 death. Duncanville Health and Rehab, 29 residents or staff and no deaths. Avenues of Park Forest, 7 residents, no deaths. Madison on March, 1 resident, no deaths. Presbyterian Village North, 16 residents or staff and 0 deaths. Village at Richardson, 2 residents, no deaths. Balch Spring Nursing Home, 1 resident and 0 deaths. Bethel Senior Care, 4 residents or staff and 0 deaths. Edgewood Rehab and Care, 18 residents or staff and 1 death. Then some new ones, Avante Rehab Center, 1 resident, no deaths. Grand Brook Memory Care, 1 resident, no deaths. And Lake West Rehab and Skilled Care, 1 resident and no deaths. So as you can see, certainly, the numbers and things that we're having, the extent that we're having continued cases in our community is significant. Had just a couple slides. This is, again, showing how we're comparing, taking off New York City to the other largest counties in the country. We're actually, still in that lower segment, so that overall, but that doesn't reflect the latest additions of new cases. But I did want on the next slide to show this is the daily count. As the judge mentioned, some of the averages of numbers of deaths over the weeks. But you can see since beginning of March, March 20th, just how our deaths, that pattern, certainly showing some increase. We had a little dip there around April 20th, 21st. But again, the numbers increasing are certainly worrisome. And the next slide, this is some movement trends for Dallas County based on Facebook data. And so it shows patterns of movement. You can see the initial, when state declaration of the state of emergency is sort of at the part, is it on the other side? Where you started seeing some of the declines. And then as you get to school closure, shelter in place, that impact on these movements. But what's a little concerning, and we had a meeting, we've been meeting with a lot of the different modelers, with the different hospitals, with the different, like UT Southwestern, some of the other academic centers that are looking at modeling this. What we've been seeing, and we've talked about that, have been looking at peaking end of April, early May. Now, there's been some upturn a little bit. I mean, it's looking more, I think the consensus was today, like it's been plateauing, and even a little increases in some areas. Because of some of these activities, you can see at the end, most recently, some of these activity levels are starting to go back up. And that reinforces what the judge was saying, how important it is for everyone to really look at what practices, as things are opening up, to really understand the importance of continuing to practice the physical distancing, to be wearing the masks, to be doing the washing the hands and the other activities, because there are some disturbing trends. Again, in the modeling group, overall, some of the hospitalizations have been going down a flat, but some of the hospitals have some increases that we're seeing. And these are the things that we're going to be monitoring. And this is the trends that we're worried about even before some of these other actions of the orders, the governor's orders, have gone into place. And that's why, again, to reinforce what the judge was saying, how important it is for everyone to continue to take these seriously and to be making smart choices. So.
Dr. Long, can you speak to, one, just the situation as it's specific to Parkland, and also just as a medical professional, what is your opinion on the governor's order that 25%, you just said, people's foot traffic is starting to pick back up now this is going to happen. So two-parter, can you give an update on Parkland, and can you give your opinion about the governor's order?
Yeah, I mean, and I think it was reported, some of the concern that Parkland is one of the hospitals that I think has seen some increases in the numbers of hospitalizations related to COVID from late last week. And some of the number of new cases were some of the largest number they've seen. So again, overall in the community, some of the hospitalization numbers have been level. But as the judge mentioned, in the President Trump's plan, some of these other documents that are out there on how to open up, they recommend seeing downward trends for 2 weeks. And so in terms of, how we interpret that, again, the modeling, the group that we were having discussions, we don't, that's not what we've seen in terms of that decline for 2 weeks necessarily. So those are very concerning. And again, it's very important and imperative for everyone to continue to take this very seriously and practice the physical distancing and all these other things.
Dr. Long, I don't know if this is a question for you, the judge, but Harris County today announced that they want to hire 300 contact tracers. They actually did hire 43 today. How many contact tracers do you have right now in the department, and do you have a goal, a number you want to reach in order to boost that?
Currently, we have we're working with volunteers also in the community, many of the medical students at UT Southwestern and others. I think we have over 150 volunteers that have been helping out with this. We've also had some temporary staff that have been hired, nurses and others that are helping out with this. The governor announced yesterday the state health department is also setting up a platform that can help local health departments through sort of having some. They've trained now. I know they trained last week 350. They were looking to have over 1,000 persons that can help with some of those contact tracing. But that's for some of the initial interviews. Some of our problem has been the ones that are hard to reach. Those other following up with those, which aren't just those initial phone calls. So we're still looking at what are going to be the needs and how we can supplement that. But again, we've had a lot of resources that are volunteers, a lot of that have been helping us with the contact tracing.
Judge, was it planned to work with the business owners as they prepare to open back up? Any education that's going to happen there to make sure that they follow proper guidelines?
Sure. The question was, what is the plan to work with the business owners? So I have a call, I think, at 6:15 tonight with members of the business community to discuss ways that we can help them with that. The governor has some good guidance there in his Open Texas. It's essentially the guidance of the Safer at Home order that the businesses are currently open or under here in Dallas County. And so it's things like taking your temperature at home, and if you're sick, don't go to work. And when you get to work, your boss will take your temperature, make sure you're not sick. It's 6 foot separation. It's wearing your mask at work. It's a whole host of things, and you can find that all of those guidances from the governor at gov.texas.gov/OpenTexas.
Is there anything extra that we might see here in Dallas County other than what the governor has established?
So we're not looking to add extra restrictions on business, but we are looking for ways to, drive compliance and adoption of those tools, which are the same tools that the CDC has laid out, that Dallas County has already laid out, that have been successfully adhered to by our essential businesses. So it's the same things that the essential businesses are doing. A lot of the things are same for all businesses: taking the temperature, wearing the mask, the 6 foot separation, right? And then there are things that are particular to a certain business, right? Like the governor has some guidance, I think I might have mentioned it earlier, on movie theaters. Each family would have 2 seats between them and the next family. Every other row would be closed. So, if people are sitting on row 1, the next row would be row 3, not row 2. And then when you look at, for instance, nothing with that business, but it is in keeping with what you've seen with grocery stores, is the mustard and the mayonnaise and the fixings at the hot dog station would not be where we all would touch it at the movie, for those who would go. Rather, it would be they would hand you a packet of relish or a packet of mustard or whatever you wanted. So making sure that we comply with those, so that those who decide they need to go to a movie right now can be a little bit safer than they would be otherwise. And because it's not just about their safety, it's about the risks that they bring out of the movie theater with them to the broader community.
You talked about trying to drive up compliance. Those look like recommendations. They're sort of, businesses should do many of the things that you listed rather than businesses must. Are we locally able to do any kind of enforcement through fines or health inspections to see that business owners are doing these things?
Yeah. So that's something that we're looking at. We cannot restrict businesses, but we can do things to help businesses do their jobs and do them safely. So, for instance, the example would be, could the city of Dallas do something to check to see if there actually is 6 foot separation between those family units in the restaurant? They could do that, but they couldn't say, you know what, in Dallas, we don't think you should sell popcorn or food at the movies. You have to do it differently than what the governor said. Okay.
What do you expect to happen with the number of cases now?
The question was about what's going to happen with the number of cases. We just don't know. The trends are not encouraging. The medical model says that we're going to peak sometime at the end of this month, which is about now, right? Or in early May. But I think we were all we were all very disappointed by today's numbers, and frankly disappointed by yesterday's numbers and the day before that's numbers. So, it's hard to say. Hopefully, my prayer is that what happens is this has been some sort of a strange 3 days, and it's going to drop precipitously tomorrow, but I don't know.
Judge, with the economy reopening, there's going to be an increased need for contact tracing and testing.
That's right.
Which you mentioned contact tracing, but what's being done to make sure that we have the tests that we need? You've talked about that in almost every single one of your press conferences. I know you had mentioned that because Dallas County was showing a bit of a flattening, that you were concerned that we weren't going to be as much of a priority as we once were. Now with this, where does that stand?
So the question was about what are we doing on testing. Dallas County is working on that constantly. My first call today was on testing. My first call after I finish with you tonight will be with FEMA, the Health and Human Services, Dr. Wong, the CEO of Parkland, and others on testing. We're doing what we can. We're not getting new tests from the call with the feds tonight will hopefully bear fruit. but we haven't seen a big increase at all in the last 2 or 3 weeks from the feds. Hadn't seen anything from the state. And so the situation is we don't have the testing that we need, or that any health professional would advise to be loosening restrictions right now. And it's particularly important. Like, for instance, we have nursing homes out there that desperately need testing. We need to know in those nursing homes, is it really that no one has COVID in the home, or is it really that only one person has COVID in the home? I gave you the example last week of when we started doing this. I went to a nursing home where there were only 2 people that allegedly had COVID, and by the end of the day, we'd found 20, and now that nursing home's in the 30s. If we don't know who's sick, then we can't effectively keep others from getting sick, right? And those nursing homes are increasingly deadly places, and so we've got to do all that we can there. But it's not just there. We had the meat plant that now has exposure. And so what happens is, as you open things, and let's say I've got a business, I sell something, and so my business is open. If I've got testing around that, we can quickly find the person who's sick, if someone is sick, and then isolate their contacts through tracing their contacts, and keep the other patrons and employees well. If we don't have the testing, so it takes days to get the results back, or we can't even get them tested for 2 or 3 days, by the time you find it, it's already spread to other people, and it's a bigger problem. If people, and this is one of the big problems with these larger congregate settings, so when you look at the scientific opening of the community, congregate meetings, that is large gatherings, are the last thing, right? It's like it goes low impact things like sole proprietorships, slightly more things, even touch things like cosmetology. Then you go to large congregate settings, like a movie theater or like church. And then last, you go to your giant congregate settings like a concert or like a sporting event, okay? So we've put some of our congregate things really into Section 1, and that's not the way science says to do it. And here's the challenge of that, okay? Let's say that a group of us all get together either for entertainment or for worship, and there's 100 people. And that's not a big church, or not a big, movie, right? But that's a movie, or that's a church. And it turns out that somebody is an asymptomatic COVID, right? Okay, so now we've got 100 people that were sitting there with that person for 2 hours at church or 2 hours at the movie, and we've got all the people that they've been a hold of that we've got to trace. So we got a lot of people to trace, and we got a lot of opportunity for spread. Conversely, if the spread is at the small bookstore that opens next Friday, that might be 2 people at the bookstore to trace and their families, right? A little bit more manageable. You think about what happened at, I believe it's called CPAC, which is a conservative political thing, and that there were a bunch of senators there. Some of them got COVID because one guy, he didn't know he's sick, but one guy shows up and he has asymptomatic COVID. You look at patient 0 in South Korea, guess where they were? They were at church, at a big mega church. You look at the outbreaks in Tennessee and Alabama, where did they really get going? Unfortunately, they got going at church, right? So it's not because, church is, if there's anything wrong with church, I love church, right? But it's because there's a whole bunch of people there, right?
Judge, one of my workers is doing in store. She's talking to a woman who owns a hair salon in Pleasant Grove, and she's thinking about reopening just like the one we saw in the past few days. She was fined.
Mm-hmm.
So she's planning basically a fine a lot, just like this other woman did.
Yeah.
But what is your message to these people?
Well, I would discourage it very much. I believe the city of Dallas today brought an action against the person who opened her salon in defiance of of the governor's order and the city's order and the county order. And the governor looked at all these things in his latest order and said, as much as I would like to do it, there's no way we can safely open hair salons until later in the month. And he gave the example of perhaps May 18th. And so when people are putting their own need to make money ahead of the public health, then bad things can happen to them, right? They can lose their license to do business. They can lose their lease. We don't want any of those things to happen. And I understand, people are hurting, but now is not the time to put, your need for making money over the law as laid out by the governor of the city and the county. There's nobody in the state of Texas who is telling you it's safe to be to cut hair right now.
Judge, what was the most startling thing that stood out to you from Governor Abbott's plan? And when will you and your family feel safe to go out to eat?
Sure. So what we'll do is we'll listen. What I do is I didn't pick my health. Let me back up because you're not Mike. So Nick asked, what was the most startling thing about Governor Abbott's plan? And when will you and your family feel safe to go out to eat? And I assume you mean like in a restaurant,
yeah.
Right? Okay. So, let me take the first one second. When will I feel safe to do something? Well, look, as I said earlier, I made my piece early on that I'm not a scientist, and it's not a time for me to try to figure out science. It's a time for me to listen to science, act on it, and do everything I can to keep you safe. And so when I'll feel safe is when the local scientists and the national scientists tell me that it's safe to do that thing. And I think that's where you need to be too. And let me say this about our scientist here. Dr. Wong is someone that was selected by not by me necessarily, but by the entire, I voted for him too, but by the entire Commissioner's Court, all right? Similarly, Fred Cerise was selected by the Parkland Board years ago that was appointed by the Commissioner's Court. But all of these other folks that are advising us, they're not advising us because they're friends of mine or because they share some political viewpoint with me. Most of these people, in fact, all but one of them, I had never met before this outbreak. They're the people the hospitals chose to be their top person. The one that I had met, I didn't meet him through politics. I met him because he was the top epidemiologist at UT Southwestern when we fought West Nile virus and Ebola. And so we can't cherry pick who we listen to, right? And it's tempting to go on social media or go to websites and just choose the person that you agree with and listen to what they say. But what I'm telling you is if you want to keep, you could dislike me, dislike everything I stand for, but it's still the safest thing for your family is for you to listen to the health experts on the ground who have the degrees and have spent their life preparing for this moment, right? The people who know what they're doing, that's who you want to listen to. You need to be suspicious of anyone who is cherry picking their advisors based on who their friends are. You need to be suspicious of anyone who is going on the internet to tell you things or whatever they want because some non-peer-reviewed paper from some university on some island you've never heard of that may or may not even exist says something different from what the CDC says.
Okay. Correct me if I'm wrong, the 17-year-old died today, that's the youngest COVID-19 death in Dallas County?
I believe it is, yes.
What do you make of that?
I think it's a horribly sad thing, and Stephen asked, what do I make of the young lady that passed away who was 17? And so it's very sad, right? I mean, it's particularly sad. That's that age when you've got them, you've done your work, you got them where they're ready to go. It's horrible. And my heart goes out to her mama and her family. It's one of the worst I've seen. But it goes with what science has been telling us, which is, although it's more likely that if you're older or you have these underlying health conditions we talked about, you'll have a bad outcome. Just today you had two people in their 30s, someone in their 40s, this young lady who had her life in front of her, who succumbed to this disease. And when you go to the hospital and you see the people in the hospital on ventilators, you're also going to see young people, old people. So it is a serious thing. It's not a thing. When I talk about Operation, Save Grandpa and Nana and Meemaw, it's not that Meemaw is the only person who is going to get sick from this. It's still nothing to play with if you're in your teens or 20s.
Getting back on the startling fact of the.
You hadn't gone yet. Let her, right? You go. Have you gone yet?
I have, but
You go. Okay, is anybody not gone yet?
And then you
No,
answer the
but I
second part
just
of my
wanted to ask
question, though.
about.
I'm sorry. Let me give the second part of your question. What was?
Which was, what was the most startling part of Governor Abbott's plan to you? What really jumped out as startling?
Well, yeah, okay. The second part of this question, which I failed to answer, what was the most startling part of Governor Abbott's plan to me? Several things that, and there were things in his plan, by the way, that I agreed with, like doing this in sections and giving time for to see what is working. But the things that I was disappointed with and concerned about is the CDC says, and every health group that's written a paper on this, American Enterprise Institute, Johns Hopkins, the local Dallas County Medical Society, the local doctors, others, have said, hey, you've got to see that decline. Donald Trump has said, you've got to see, Dr. Birx, you need that 2-week decline. No, we didn't do that. We're doing this on the upswing. So that was a big concern. The next thing that was a big concern is we didn't take into account or have a call and listen to the local health authorities, right? And I think Texas, as the governor points out, it's a big state, but I think the situation on the ground may look different in Dallas than it does in Abilene or some other place. And so I think that that is an opportunity that I hope will happen. I hope there'll be more communication with our medical community. And then as far as the things, when I saw things that were in Section 4 of other people's plans moved into Section 1, and things that were in Section 1 of other people's plans that were left closed, that was a surprise. But look, here's the thing. Governor Abbott is the governor of Texas. And we have the orders from the governor of Texas. And so we are going to have to survive and thrive underneath these orders, whether we agree with these orders or not. But the important thing for you is the orders will change as the political winds change, right? But the science underlying what keeps you and your family safe does not change with that. So if tomorrow someone says we should all go to a Dallas Cowboy game, the science won't change, right? The science says in a place of substantial community spread, you shouldn't do that. You need to look at what the science says in keeping your family and our community safe in the face of these changing orders. And I'll take one last question, and then we probably ought to wrap it up.
Just following on that real quick, I mean, the governor could have written his order to say, counties can do more, but they cannot do less than these minimum things that I'm requiring, right, or these limitations that I'm putting on. What do you make of the fact that the governor early on left it to counties to make their best decision about closing down businesses, doing stay-at-home orders, and when it comes to reopening, has sort of taken the whole state is going to have the same rules approach?
Okay, so the question.
Just trying to be a little more pointed here about essentially earlier on, when it came to stay-at-home orders, the governor left it up to counties to do sort of as they will, and Dallas County acted when other counties did not. Now when it comes to reopening, counties are sort of all forced to go along with what the governor's order says. Would you, did you lobby for more deference to sort of local, facts on the ground when it came
Sure.
to this?
So the question is, think of, and I'm going to paraphrase this, and you tell me if I got this right, because it was long, is two-parter. Did I lobby for more deference to the situation on the ground? And what do I make of the difference in the governor's hands-off approach early on and his aggressive approach to push opening later, or now, right? Okay, so yes, I did lobby for the governor's team to listen to the local health doctors, and I lobbied for the governor to consider the CDC guidelines rather than what he came up with. And I lobbied for looking at what the situation on the ground, what's actually happening, and listening not to the politicians, but to the doctors who were on the front lines and the scientists on the front lines. So yes, I did. You know, as far as the second part, what do I make of the hands-off approach early on and the you know, aggressive opening of businesses now? You know, I don't know what really, I don't know what I really have to add on that. So when it came to putting Safer at Home in place, that was led by the counties, right? I was the first county in the state to do it, but it was quickly followed by 5 other counties: Harris County, El Paso County, Bexar County, which is where San Antonio is, and Travis County, where Austin is. And then within a day of that, it was followed by all of North Texas, and I believe some of the surrounding counties of those other urban areas. And, you know, but it's a different situation with this. And the law allows the governor to come in and say, I'm not bound by the CDC guidelines. I'm not bound by President Trump. I want to try something different. But again, that's not the guiding star for your family. The guiding star for your family should be, what do the epidemiologists? Epidemiology is the study of pandemics like this. What do the infectious disease doctors say? This is an infectious disease. What do the public health professionals like Phil Huang and his counterpart in Tarrant County say? People who study their whole life for situations like this. That's the best way to keep your family safe. It is counterproductive for you to pick a side and treat this like a political debate. This is not a political situation. It does not matter whether you vote Democrat, Republican, or never have voted and never going to. If you get sick, this is a bad deal. So if you want to keep our community safe and your family safe, you follow the advice of the public health doctors, and you make smart decisions, even in the face of new opportunities to make more risky decisions. Thank you all for.
Dr. Wong, you guys confirm how many cases were at the quality sausage plant?
I don't. Do you have the number on the sausage plant?
No, I don't.
We can get you that.
Okay.
I don't have one. Thanks. Thank you all. Do you need one of these for Spanish? Here.
Reach out to the governor and ask him to consider in this broad opening.
Yes, sir.
You did. When's the last time you did that?
We had a 30-minute conversation.
On Friday?